Hey there, everyone. Welcome to Revolutionary Health. Revolutionary Health is a program of the Counter Narrative Project, and the mission of the Counter Narrative Project is to build power among Black gay men and to work in solidarity and coalition with all movements committed to racial and social justice. You can find us online everywhere. So on Instagram, we are at the Counter Narrative. On Facebook, we are at the Counter Narrative Project, and on Twitter, we are at Building Desire. Visit us online at our website at thecounternarrative.org, and while you are there, make sure that you sign up for our mailing list. I am so grateful to be here. I'm honored to be the mobilization director for the Counter Narrative Project, and I am joined by
Dr. Quintin Robinson. He's not going to give me one. He's like, y'all know me by now. I'm David Malebranche, physician and just clown. We've been clowning a lot before we started today, and y'all see why in a little bit.
In a little bit, indeed. So make sure, if you are with us right now, make sure that you hit the subscribe button. It is the red subscribe if you haven't subscribed already, and make sure that you hit the like button to like this video, and go ahead and share it on social media and let people know that you are joining us. We have a chat box right there. I am going to be doing my best to pay attention to the chat box. Make sure that you go ahead and type your questions, your comments into the chat box, and we will do our best to get to them on the show.
And say hello too, if you want to say hey.
Just say hey.
Let us know you're there.
So, we have a couple of things that we're going to cover tonight. So our big topic that we'll get to in a minute is testicular cancer. Mm-hmm. I'm really looking forward to this because I already, as we were just talking, learned a ton of stuff. So I know that all of you will too. But I wanted to take a pause, right? So coming into popular culture, so I was playing around. First of all, I've just been in front of my computer all week. That's bad. You got to walk away from the camera, from the screen sometimes. But shuffled up to the story about Dwayne Wade's son, Zion, and the picture of Zion and Gabrielle and Dwayne Wade's other son at Pride. And it was the cutest picture. Mm-hmm. And I literally passed it by. I was like, oh my God, that's so adorable. And I went back to what I was doing. And then realized that there was a whole other firestorm happening of people talking about this.
Just salty.
Just upset. And I wanted to start there because my particular vantage point is, one, if you've never been to Pride, you should probably go because it's fun. I try and convince a lot of my friends to just go. It'd be a good time. Right. And I believe that there is a perception of Pride that people have that is, those things happen, but it's also not true largely, right? So I thought the pictures were cute, and I didn't see what the big deal was. But I wanted to chat really quick with the both of you and see if you had thoughts about some of the stuff that you were reading.
Well, like I said, we were talking earlier. When I saw it, I was like, okay, kind of big deal, and I kind of moved on. But to your point where you were saying this other side of it, what I did notice, I think the way my social media is set up, so to speak, that a lot of the negativity doesn't really make its way in.
Right.
So one of my friends from college had posted the picture on Facebook, and then she wrote the comments. She was like, wow, there's so many positive comments. Mm-hmm. So looking at it on Facebook, there was a lot more positive comments. Mm-hmm. And then kind of looking at what was commented, for instance, on Instagram, it was completely different.
Interesting.
It was the same picture. But my overall impression was like, okay, kind of big deal. I didn't really think much of it when I saw it.
Yeah, I didn't think much of it either. I thought it was just the cutest picture, and they said that the kid was 11 years old. And there were two things that I saw. One was V103, the local radio station here, posted something like, should a kid know or does a kid know their sexual orientation by age 11? Let's discuss. And someone was like, oh, they're just trying to spark conversation. I said, nah, it's some bullshit. V103 has always been a fucking homophobic station with homophobic idiocy on there. And what I noticed was that they were trying to kind of bait people. Because you know how people are going to answer. Does a kid really know he's gay? And I was like, so if a kid was 11 and had sex, or if a girl was 10 and got pregnant, would you say, how did that woman know that she was attracted to dudes enough to get screwed and, have a baby at 10? Like, let's discuss. We don't discuss that, but we're discussing this. So let's not pretend like it's not about sexual prejudice and people not liking same-gender couples. So I thought that was a part of it. The other thing was kind of interesting to me is that I saw several comments where people were like, oh, this is wonderful. Their 11-year-old son came out. And I was like, okay. The kid's fucking 11 years old. He doesn't know. His only conception of a closet is where he puts his toys and his clothes. So why are we imposing this rigid kind of Eurocentric, old-ass concept of being in the closet to an 11-year-old who just knows who he is and what he's attracted to? And even if he didn't and he just went to kind of support it, would be no big deal either. It's on both sides. We almost like want to impose our own shit on this little boy, and I was like, just let the little boy be. Just let Gabrielle be the good stepmom she is. Let Dwayne be the good father he is, and just move on.
Yeah.
Like, move on.
No, I am. Thank you both so much for that, because I was very much there. I wanted to spend a couple of minutes on this because I think we have to listen. What I know is when I think of me as a young kid, right? I know, of course, I had an inkling of who I was. Then I had to put on the mask and try and hide it, which I did for many, many years, up until I was like 20. Mm-hmm. But imagine if I had the support.
Oh my God.
Imagine if I had the support. Like, I have no idea what type of person that, and not to say that my parents wouldn't have, at the time was different, right?
Right.
I don't know that would have been a thing, but wow, what my life would have been like.
Right. And like when you were mentioning that we were going to talk about this, I kind of thought of, again, myself being a native of Atlanta.
Right.
Truthfully, I had no idea about Pride or Atlanta Black Pride until I was a sophomore in college. Like, it was like having grown up here, it's just, at least for me as a kid, none of this was on my radar in either direction.
Right.
I was just like, I got up and I went to school, I came home, I cleaned up, remember like I was supposed to when I watched cartoons on Saturday morning.
Right, it was easy.
That was pretty much it. There was
Right.
nothing else, and I think a discussion of it really didn't occur within the family. It was, I of course remember the rumors and the whispering when I was in school, but I didn't think much of it. And my parents and my cousins really didn't say anything about it because we were all in my cousin and I were in the same classes. But it was just kind of like that's just it was who I was, and whether I recognized it for whatever it was myself, it really didn't resonate until I was a sophomore in college in New Orleans. And I was like, why is everybody going to Atlanta in September? I'm like, what is there to do? I'm like, it's like I grew up in Atlanta for 18
kind of
years.
festival going on?
What is this? So to that point, I honestly was completely clueless to it all.
Wow.
Yeah, that's fine. I mean, I was in upstate New York, and I knew I was attracted to other dudes at that age. But I mean, I did the same thing y'all did. You kind of put on the mask. You kind of pretend you like girls at the same time. But I knew I was attracted to other. I just didn't know how to phrase it or how to put it into words or how to express it verbally or any kind of other way. So I just thought it was great to see that. I paid less attention to that picture and more attention. I don't know if you saw the Budweiser commercial that honored Dwayne Wade.
I didn't get a chance to see it.
Because yesterday was his last home game
Okay.
at Miami Stadium, and they had this commercial where they brought him out into a court, and they brought out all these people whose lives he had affected in different ways, and one of them was the sister of one of the victims of the Parkland shooting, and his favorite player is Dwayne Wade. They actually buried him in a Dwayne Wade jersey, and then his mama came out as the last one. And I mean, I was like crying when the first person came out, but it's literally like a 4-minute video. But if you watch it, it's just so positive and affirming. It just shows what a good guy Dwayne Wade is, both as a NBA player and just a human being. He just seems like a good dude. And so that picture and what the way they're handling their son, I think is just a reflection of that.
I agree. Thank you all. So, thank you, Dominique, for joining us. Dominique said, greetings, good brothers. Dominique Perry checking in. Hey there, Dominique. And if you are watching, make sure that you go ahead and hit subscribe and make sure that you hit like on the video. So, we are here to talk about testicular cancer. In my experience, I've never seen like a video, I've never seen like a conversation like what we're about to have tonight about this particular topic.
Sure.
But before we even get to testicular cancer, right, there is just testicles, right? And I think we have a concept of what our body is doing, but I would like to start there. And yes, we have some testicles here that we haven't named, but they're going to be with us tonight, and we're going to,
D's. That's what we gonna name.
Welcome to D's.
D's nuts.
You had to.
I'm sorry. But can I tell the story behind this?
Please.
So look, we were going to try to do a live demonstration. And Johnny was fully willing to cloak himself, and then we would kind of do this. And actually, in Australia, on TV they did a live YouTube video demonstrating how to do a testicular exam from a doctor on a patient.
Yep.
And it was great. But of course, this is the United States. We're a repressed society, so we don't do that. And we'd run into all kinds of problems. So I ran around online looking for a set of nuts, and these are rubber, right? And so the only color they came in was white.
Right.
So as most of these examples do. So I had to go to Home Depot today and buy some brown paint. But did I tell you all the name of the paint?
No.
You did. That's why I was like, what was that?
This shade is called Havana Coffee.
Yes.
And it's not scratch and sniff, in case any of you were wondering that. But it is rubbery, and it does feel like nuts. So we're going to talk a little bit about the testicles, the scrotum, the function of it. I don't know if you want to start off, Q, and then I can join in.
I'm the specialist, so this is internal medicine.
It's an internal medicine. Okay. So this is your scrotum, right? And so your dick hangs kind of in front of here, as you all know.
Yes.
But your scrotum actually carries your two testicles, which are right here. And then connected to that, and your testicles are what produce sperm and testosterone. And then you have these organs called the epididymis, and they're on the top of each of your testicles.
Got it.
And they're basically organs that store sperm and so that it can mature. So when you actually come, it's mature sperm that's coming out that can swim up and do whatever they need to do or go wherever they need to go. And so when you're doing a testicular exam, everyone asks, well, what should they kind of feel like? And they should feel like they're kind of small, like almost grape size, walnut size, and they should feel kind of squishy.
Okay.
And, the guys can feel this as well, just so you can kind of demonstrate, but Quintin's passing on it. But it actually feels like a little bit squishy. So when you're doing a testicular exam, and guys, when you're feeling yourself, what you have to know is that the best time to do an exam is when they're actually descended. And so usually that's in a situation when you're in the shower, when it's warm, and the testicles just naturally kind of drop down into the scrotal sac, and then you can kind of feel them better. And if you feel anything hard, anything like that's a lump or small little nodule, almost like a pebble or a marble, that's where you want to kind of get it checked out. Usually testicular cancer is painless, so you're not really going to have any pain in your testicles. If it's pain in the testicles, it's probably going to be something else. And we can talk about a few of those things, but typically what you're doing is feeling around for any kind of painless lump. And that's how you kind of do the screening for it.
So when we think about, thank you so much for that explanation. So when we're thinking about the test itself, obviously so I have a question first before we go there. Testicles are, they're fragile, right? So, it causes pain.
Right.
So as you're just feeling around, it's, just being gentle, I would imagine.
Right, yeah, and like when you were kids, I don't know if any of y'all did this, but I had obnoxious friends that if you'd be wearing basketball shorts, they would just tap.
Yeah.
And so you don't even have to get kicked in the nuts or have a hard trauma. You just get a tap, you'll be crippled and down on the ground for a long period of time. They're very, very sensitive, so you have to be careful and handle them with care. But I think, the thing is testicular cancer, maybe about 20,000 cases that we see a year. It actually happens, this is one of those diseases that happens more in white men than in black men. And the age group where it particularly happens is between the ages of 15 and 35. So it usually skews a little bit younger. So if you're older than 35, the recommendation for, whether you're going to do these testicular screening or, kind of feel on your nuts once a month to kind of make sure everything is okay is really not that relevant, because when you're older, your risk of having testicular cancer is a lot lower. We were talking a little bit about the recommendations.
Yeah. So we were, in preparing for it, I was like, let me see what to give the most accurate and up-to-date information. And in reviewing kind of those organizations that make recommendations on when to screen, how often to screen, I was actually surprised that one of the biggest organizations in the United States was actually recommending against at least routine, meaning that it recommended that doctors should not tell patients to do this regularly
Right.
once a month. Not to say not to do it at all, but one, if like we're having this conversation, there was a concern about it. So just occasionally, like when you're in the shower bathing, it's just like, let me just kind of feel and see if everything's okay. But there's no official, like, for breast cancer screening, getting a mammogram every year, or colon cancer screening, getting a colonoscopy every 5 to 10 years, depending on your history. The recommendation used to be that we tell patients to do this, but now I was really surprised that they're like, yeah, you don't really have to tell patients to do this as we were a couple of years ago.
Yeah, and the definition, we were talking about this before, the definition of a good screening test is a test that can detect a disease early enough where if you catch it early enough, it's going to reduce the complications from the disease or your likelihood of dying from the disease. So what they're saying is that from the research, you screening by doing these self-testicular exams actually doesn't reduce complications from cancer or your likelihood to die from it, which is interesting because a few years ago...
Yeah, I honestly remember, when moving into private practice from like general medicine to even, specialty practice, my younger patients, I never did not talk about like that especially if you're a new patient.
Yeah.
And I was like, hey, have you ever talked between those ages less than 30?
Right.
Do you do like monthly testicular self exams? I asked the question. They're like, no, what's that? So we talk about it. I was like, well, the next time you're in your shower, do this. And because it's a new patient visit for a physical, I would show them how to do it. But it was that one and done from the medical provider standpoint. And I think we were talking earlier, it actually came in handy because I had a patient, in the 9 years that I've been back practicing in Atlanta, a patient did exactly that. He detected his own testicular cancer where he was like, hey, doc, he called me, I was, hey, doc, I felt something weird when I was in the shower.
Right.
And so knowing that he was in that risk group, I was like, okay, what was it? And we talked about, well, what did it feel like? And I was like, did it hurt? He was like, no. I was like, well, we're going to set you up for an ultrasound, which is the kind of the next step. If you feel something that's not normal, it doesn't feel like what it's felt like before, the usual first step is just an ultrasound.
Okay.
Where they use a wand, some cold gel, and use sound waves to get an image of the testicle.
Yeah.
And like in his case, he went from an ultrasound. The ultrasound tech or the radiologist who reads it called me and said, hey, there's something there. I then called the patient, told him, got him set up with a urologist. He had a surgery and had the testicle removed and then saw an oncologist all within the span of 2 weeks, which is actually amazingly fast in the American healthcare system. But, and I can't remember how long ago that was, but it was one of those, again, just routinely just showering. So he really wasn't doing an exam in particular, but he just felt something that wasn't normal. And, he was astute and, aware enough to say, hey, doc, and call. Because a lot of times people...
That's important because we don't... I mean, I now will talk to a doctor, but I wasn't always that way, right? And this person was, and that so there is a lesson.
I'm one, and I still don't call doctors when I have stuff going on.
Right, and I mean, if you do feel something, I think it's important to kind of get it checked out. That's why we mention it. But similar to what Quintin was saying about his patient, like people will ask, what are the causes? Like, what causes cancer? And cancer cells are just abnormal cells that grow out of control. There are a couple of risk factors to look out for. One is younger age. But not really risk factor, but that's the group that it happens in. The other is that when guys are born and when we first come out of the womb, our testicles take some time and then they both descend down. So sometimes people have a condition where only one of the testicles comes down. It's called cryptorchidism. And so I didn't want to have to say that, but it's overly biomedical. But one of the testicles doesn't descend, and so if you only have one testicle descending, that's actually a risk factor for testicular cancer, as is a family history of, I don't think anything like smoking or anything like that, but family history, one testicle descending, and just being in that age group are all kind of risk factors. Symptoms, you won't really have much pain. You'll just feel like a little lump there. And then the treatment, once you get it detected, the test that you do is the ultrasound. That'll find it. And then I think they'll do a biopsy and figure out what it is, or do they need a biopsy at that point? Just
at least I remember or being taught that they don't even do biopsies anymore. It's like if there's something just take it out.
Yeah, and then they have to stage it. So they say if it's just a mass that's in the testicle, so it's just limited here, or you have some lymph nodes. Oops, I don't want to leave these. And it may go up into your lymph nodes, and then if it spreads further, it can go into your lungs and actually as far as to your brain.
Interesting.
And the most famous case we have of that is the bicycle rider Lance Armstrong. And why everybody made a big deal about him winning the Tour de France a few times is because he had testicular cancer. It was not only in his lungs, but also in his brain. So he needed to have, for the surgery, you'll have one testicle removed. You'll have the full testicle removed. If it's spread to the lymph nodes, you'll get those lymph nodes removed. And then you can also have radiation to the area, which can cause infertility and low sperm count. And then also chemotherapy, obviously, which has a whole lot of potential side effects. So it's not really a joke. And again, it's not really as common as some of the other big cancers.
Yeah, exactly.
And I think that's also part of the reason why the U.S. Preventive Task Force Services doesn't really look at it as a real screening test. I think at the end of the day, for me, and I want to hear your take on this too, I would tell if you're young, if you're between 15 and 35, you got to know your body anyway.
Absolutely.
So when you're in the shower, you're jacking off anyway, you may be masturbating. So like feel your nuts and know what they normally feel like when you're not having any pain, when you're not dealing with anything. And then you know the norm. So if you feel it at some other point and then you feel a little lump or something that's abnormal, you'll know to get it checked out. So I tell people, maybe it's not recommended as a screening test, but I think when you're young, you don't have to do it every month. But every time you kind of remember you're feeling down there, go ahead and just check them out. Make sure everything's okay. And if you want a doctor or a medical provider to check them out, just ask them so they can do it.
I feel exactly the same. I don't necessarily give the recommendation that, we tell you not to do it. I was like, you're in the shower, you're doing it anyway.
Yes.
Right.
So just pay attention to what it feels like on a normal given day.
Got it.
And then the next time you're showering, if it crosses your mind or you're just really just singing along as you're scrubbing, it's like, hey, this doesn't feel right.
Yes.
You can do it. And the thing is that exactly, he's
I
singing in the shower.
I would totally be singing along.
Right. No, people do it. So, and I mean, the other thing is that I don't think we mentioned already, but there are other things that can kind of cause little masses.
Okay.
And it's not just testicular cancer, but you can have like a collection of immature sperm, which is called a cyst or an epidermoid cyst that can be in there. You can have a collection of water that's called a hydrocele, a collection of veins which feel like, they call it like a bag of worms.
A bag of worms.
They call it the bag of worms, but you can feel over here, and you feel different things. Again, I think the take-home message that we're trying to give to y'all when you're thinking about your testicular health and what to screen is feel around and get to know, your balls like as what they are.
Bodies.
Know your body for what it is, and then so you can detect actually when something is abnormal.
I have a question around, so when there is a testicle removed or a testicle does not descend, how does that affect sperm count? Does it affect sperm count?
It depends. I mean,
Okay.
you because no one routinely does sperm counts unless you're planning to, like, it's part of an infertility workup. So unless you've been trying to have children and you can't, so it's not a routine test that we would do.
Right.
I mean, just mathematically thinking, I would say yes, but we really don't know. But the other thing is, though, with that, because in terms of you look at the anatomy in general, you have the two testicles here. When they remove one, like my patient actually had a prosthesis just for
for aesthetics.
Yeah, so just for aesthetics and just kind of that feel of being normal.
Right. Yes.
So he had one put in at the same time that he had one removed. So
Right.
he had like essentially a plastic ball put in at the same time.
Interesting.
But I will say, as you get older, you probably see a faster decline in testosterone production just because you're used to having two in terms of regulating. So you may not necessarily see a decrease in sperm count, but you'll definitely possibly see a decrease in overall testosterone production.
Yeah, I don't know if it's, I'd have to admit, I don't know if it's kind of like the kidneys. So like you remove one kidney, the other kidney kind of picks up the function, and you can live with one kidney for a long period of time and never have any decrease. But it would make sense that, if because your brain signals your testicles to make testosterone, so it would make sense that if you only have one, you may not be able to produce as much before, which testosterone is, produces symptoms of, having energy, your muscle mass, your sexual desire, kind of your muscle tone and stuff. So if you only have one that can produce it, you may have some symptoms. But I don't know whether after surgery someone has like hypogonadism or low testosterone levels because of that. It could be the case.
Okay.
So.
My last question for the both of you is if there is a takeaway that you would want to leave the folks out there with as it relates to testicle health, like either cancer or testicular cancer. Is there any one thing that you would leave the people out there who might be watching the show with?
I think the one thing is kind of like what we've kind of reiterated the whole time is that just know what is normal for your body. And I mean, start early to know what's normal, because things can develop late and you can think that they're normal and they're not. But just get to really know your body and pay attention to things and how they change.
Yeah, I would agree with that. I think there's a whole bunch of things that can possibly go wrong. We didn't even cover like how you can get infections in the scrotum and in the epididymis that require you to be on antibiotics for a longer period of time. It would cause, like, I've seen guys have bacterial infections in here where the scrotum kind of swells up, and they start having like blood in their urine, and they have a lot of tenderness and fevers and chills. And so you can get infections that start off as like an STI, like chlamydia or gonorrhea, or even the bacteria E. coli, which comes from the gut, and it can track back into your epididymis, into your testicles, and cause an infection, and you need to be on antibiotics from anywhere from 2 to 4 weeks. Sometimes usually 2 weeks, though,
It's
right?
usually 2 weeks.
Okay.
Excellent.
So yeah.
So I want to thank the two doctors for all of their amazing information, and I want to thank all of you for having tuned in this evening. If there are things that come up after you watch this video, if you're watching this video and it's not live and you still have questions or you're still thinking of things, right, make sure that you go ahead and put them in the comments. We do read the comments, and we will make sure that we take a look. And I actually see something coming in. So thank you so much, Dominique. I'm actually going to bring in your comment now. And Dominique mentions, I noticed the strings attached to my testicles get tangled in a knot. All my life, the knot comes and goes. My doctor says it doesn't bother me. Then it should be fine. Could this doctor be wrong?
So they're to the direct question.
Yeah.
If they get tangled, it sometimes can be okay if it's not painful. If they just kind of feel like, when we talk about the varicocele, the bag of worms, that could be that. So it's not necessarily knowing whether your doctor's right or wrong. It's like, if you're concerned and it happens again, an ultrasound is an easy, non-invasive test. You can look and see. But in reading the question, it led me to think of something else that we didn't talk about, which is called testicular torsion, where your testicles kind of hang in their normal left and right position, but it usually happens a lot in athletes, usually runners and basketball players, when they're moving a lot, where they can get twisted. And that actually is a medical emergency. So that's one of those things. If you ever notice something where you're really, really active and you get this, excruciating pain in your groin, and you notice that, hey, these don't seem to be in their normal position, that's one where you should really go to the emergency room, and it requires surgery or manual manipulation to untwist them, because it can actually cause pretty fast death of one of the testicles.
Yeah, I was gonna say, if you think about, like most organs, the testicle has nerves as well as blood vessels that are coming down. So you can imagine if this kind of twists on itself, I almost put it akin to having a heart attack of your testicle, because what it does when you twist up those cords, imagine like the nerves and the blood vessels sitting there, and then they all get twisted up on each other, and the blood flow doesn't go to the testicles anymore. So it's losing oxygen, it's losing its blood supply, and essentially when that happens, it's having a heart attack. So your testicle is having a heart attack, and it's a medical emergency, so you need to actually go in there and have emergency surgery to kind of disentangle or remove the testicle if it's already dead. But the pain that's associated, I've only seen one person in my life who has had testicular torsion, and he was in the most excruciating pain I've ever seen anyone be in, and he got whisked off to surgery like within seconds. So it's a great question. I think what you may be talking about may be what's called varicocele, where it's just kind of a collection of blood vessels. If it's always been there, it may not be something to worry about. What we usually tell people is just kind of keep an eye on it, keep feeling it, and if you notice any changes from its norm, then you go and see somebody or have someone else take a look.
Perfect.
Or if you have a partner, have your partner feel them. If they know the feel of your nuts pretty well, then have them kind of reach around and see what's going on.
Absolutely. It comes down.
I had
that's
to.
so
Come
important.
on.
Pleasure. I mean, listen.
Listen.
This is our lives, and we live full lives. Dominique, thank you so much for that question, and thank you both for those comments.
Thank these.
Yes, thank D.
And I said these, not these. These.
So a few things that all of you should know. So on social media, you can follow us at on Facebook at the Counter Narrative Project, on Instagram at the Counter Narrative, and on Twitter at Building Desire. Go ahead and join us at thecounternarrative.org, where you can join our mailing list. And we are here for Revolutionary Health just about every week. Next week is our week off, so we will be actually rerunning a show featuring Billy Porter on Facebook.
Right.
So join us on Facebook. We will be rerunning an episode that we had with Billy Porter from Pose.
And Pose, the season 2, the promos have already started coming out.
And they're
I think
amazing.
June 9th, it looks gorgeous. So
Yes.
you'll get to see him talk about childhood sexual abuse
Yeah.
and kind of his journey with it. When he came and was gracious enough to sit down and talk with us for a little bit. So yeah, it was nice.
Yep, so join us on Facebook. So a couple of things that you need to know that are coming up. Tomorrow, we will be having an online discussion. What can us teach us about being Black in America? So that is going to be taking place online. You could still RSVP. If you go to our Facebook page, you'll see the event. You could still RSVP until the morning. Next Tuesday, so that is the 16th, happy birthday, Essex. We are going to be celebrating the life and legacy of Essex Hemphill by having a birthday celebration. So you can join us in Atlanta live at the Auburn Avenue Research Library. And next Wednesday, here, that's why we're off next Wednesday.
Right.
We're having an event. What would participatory budgeting? So what will participatory budgeting mean for Atlanta? We're going to have Amir Faroqi joining us, who is a city council person, and that's going to be here next Wednesday. So
What does that mean? What does that mean, participatory budgeting?
Participatory budgeting. So it is. It's complicated. Well, it's the budgeting process as it relates to stuff within the city.
Within the city, okay.
Yeah.
All right.
So it's
us being more active in it?
and participating in that process.
In the budgeting process.
Yeah,
Got
what
it.
would participatory budgeting, like what that would mean if that was something that we
For the
participated
city. Yeah.
in.
Okay.
So that'll be happening next Wednesday here at the Rush Center. And I think that's everything. Thank you so much for joining us this evening for Revolutionary Health. Please take care of yourselves. Follow us online. Make sure you subscribe. Make sure you like the video. And we will see you all in 2 weeks. But come to Facebook next week for Billy Porter. We'll be showing that show.
And take care of these.
Take care of these. Thanks, everybody. Have a good night.
Bye, y'all.